All right, Mr. Smith, we're going to go ahead and give you this antibiotic that we talked about, okay? So I'm going to just walk my students through what I'm doing. So we're going to do a secondary or a piggyback for the patient's antibiotic. We've done our 6 rights of med administration. We've checked those in the med room, outside the patient's room, and now we're checking it again at the patient's room. So we did the right drug, the right patient, the right dose, the right route, the right time, and then we'll document that. Okay. So the patient's going to tell us his name and date of birth again. All right. Thank you, Mr. Smith. Just clarifying again, you're not allergic to anything. Thank you. What I have here is my antibiotic. I have my secondary set. This is called a piggyback sometimes, but generally your tubing will say secondary set. I've got a flush, and I've got some alcohol swabs. I'm going to go ahead and just kind of look at my pump and see. So my primary infusion is running at 200 mLs per hour. So I have just normal saline. So I know that normal saline and cefazolin, which is my antibiotic, are compatible. So I just want to make sure that whatever's hanging here, if I'm going to hang it as a piggyback or a secondary, that what I'm hanging together are compatible. Okay, and so they are. I also need to ensure that my patient's IV is functioning properly. Now, because my patient's IV already has fluids running and it's running at a fairly significant rate, I don't need to pre-flush this IV. If the patient didn't have anything running, or if the fluids were running very slow, then I would want to flush it beforehand to ensure that that IV is functioning properly and there's no infiltration. Okay, so my secondary set is just tubing that is slightly shorter than the primary tubing. The secondary tubing is just going to go from the pole to the top here. So it's not going all the way to the patient like our primary tubing was. So I'm going to go ahead and I'm going to open my tubing. My tubing is very similar to the other tubing, so the primary tubing. So when I open it up, I have a tubing in there and I have this little hanger. So when we talk about doing a secondary infusion or a piggyback, we are running it with the assistance of gravity, meaning that our primary infusion needs to hang lower because our secondary will hang higher and it will go in first, right? So the first thing I'm going to do before I forget is I'm going to go ahead and take my primary down and use the little hanger in order to hang it lower than my secondary, okay? And then the next thing I'm going to do, so just like our tubing before, we have a spike and an end, spike in the bag, end on the tubing, okay? Stay sterile. I want to go ahead and clamp down in order to close the tubing off. I'm going to grab my bag. I'm going to pull my cap off of my antibiotic and then off of my spike. Remember, I want to keep that spike sterile. Put it in there, twist it. And what I'm going to do is just hold the chamber and release it about a third of the way full. I'm going to go ahead and hang it on my bag. Now, there are a couple of ways that I can prime or flush out the air in my secondary set. When you have a secondary or a piggyback, generally the bags are smaller. So my antibiotic is 100 mLs, which means that I really cannot let more than 1 drop of the medication come out when I'm priming or flushing it. Otherwise, the patient's not going to get their full dose. It's even more difficult when you have smaller bags. So you may have a 50 ml bag. In order to prevent losing medication, you can do something called back flushing or back priming. And that is the first demonstration that I'm just going to show you. So we have filled our drip chamber. We've clamped this off. I'm going to go ahead and locate the port at the top of the primary. So the port that is not closest to the patient, closest to the IV bag. I have a swab cap on there. I'm going to go ahead and remove my swab cap and grab my alcohol, clean my port, and then I'm going to take the cap off and connect it. And then once I've connected it, I'm going to take my bag and I'm going to put it lower. So I'm going to raise my primary infusion up a little bit on the pole so you can. So what I want to do is I want to go ahead and lower this below the primary, and I'm going to unclamp it. And what is happening now is the fluid from here is backing up and going into my antibiotic. And what's that allowing to happen is that is allowing the tubing to be flushed without me losing any of my medication. Okay? And then I would program the pump and ensure that it's at the correct rate. That is the easiest way to do it, and actually the safest way to ensure you don't lose medication. The other thing that you can do, so let's rewind. We'll put our cap back on. All right, so I've clamped my tubing, I've spiked my bag. I'm going to hold my chamber and fill it a third of the way full. I can go ahead and hang my bag, and then before I connect it, I can flush it this way. So keep in mind, this tubing has already been flushed, but as a demonstration, I just want to show you how you could do it this way. So before you connect it, you would have your hand on the roller clamp, and then you would open the roller clamp up slowly until all the air released out, and you got your one drop, which is going to happen pretty quick regardless. So see my more than one drop. So once I get that, I'm going to immediately close the roller clamp, and then I can go ahead and scrub my hub, same place, and attach my medication. And most importantly, ensure that you unclamp the roller clamp. If you do not, your medicine will not be delivered. The primary will continue to infuse, and your secondary medication will not infuse. This is another reason that back priming or back flushing is a safer option, because you won't forget to unclamp it, because you'll already have unclamped it in order to prime or back flush it. All right, and so I also want to make sure that I've added change of date tubing, or change of date and time that the tubing needs on both my secondary and my primary set. And then just document, ensure that I've documented the medication that I've given, and then I will come infused. We can take it down. We're just going to remove it. We're going to unclamp it here, or unconnect it here, and then I'm going to go ahead and raise my primary back up. And then I just want to ensure that my pump kicked over onto the correct rate back to the primary.